I think one of the best things about both the Trump presidency and the Obama presidency is that it has reminded Americans about what's at stake, right? There is a tendency to believe that things run on autopilot in the country. There have never been so many Madisonian Democrats as there have been in the age of Trump. A new love of constitutional separation of powers, federalism, all of this stuff suddenly comes into vogue for Democrats. And for Republicans, for conservative Republicans who look at the world that way, for constitutionally minded Republicans who say, well, where were you when Obama did it? I say, welcome them to the party. Hypocrisy is the tribute that vice pays to virtue. Hypocrisy is considered a cardinal sin in politics, but hypocrisy is what lets us keep sort of the bandwidth together, the bundle together. There are certain public norms and virtues that people have to respect even when they fall short of the mark. And what's been great about this cycle has been the Democrat. Who would have thought only Donald Trump could make Alexander Hamilton, the first Republican, a hero to the Democrats? So engagement and attention and all that stuff really has value. And let's see how we do next time. Maybe a way to think about it isn't that we are more polarized, but that we are better sorted. So prior to 1996, things were much more regional. Things were much more people. There were, in 1964, the party that was the most in favor of civil rights and the most opposed to civil rights, the Democratic Party. In 1980, the party that was the most in favor of access to elective abortion and the party that was most opposed to access to elective abortion were Republicans. All of the moderate Democrats left. All of the liberal to moderate Republicans left. And we ceased to be Tip O'Neill famously used to say all politics is local. Not anymore, Mr. Speaker. The truth now is, because of mass media and because of the connectedness of everything, yes, talk radio, yes, cable news, but now, steroidally, with social media. The parties used to be mechanisms for winning elections. Now, and we talked about this in the speech, now oftentimes partisanship is the only purpose, right? Mm-hmm. Which tribe am I in? We do polls where we test questions like, what do you think about a plan for universal single-payer health insurance? And the Republicans go, boo, 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 boo. What do you think about President Trump's plan for universal single-payer health insurance? I don't know, I'm open to it, I want to talk about it. I like to say partisanship is like peach brandy. A little of it can add fun and excitement. Too much of it will leave you with a splitting head and empty pockets. And we are well drunk, we are well soused on partisanship, and that is in part because we lost those old regional ties where a Tennessee Republican and a Tennessee Democrat, as we saw for a long time, right? Tennessee Republican and Tennessee Democrat weren't much different, and they certainly had more in common with each other than they would likely have somebody, regardless of party, from New York or California. Things have changed. We will, I will state optimistically, we are all sorted out, everybody went to their respective sides. We will have new centers of gravity from a sense of media, from a sense of trustworthiness, from a sense of accountability that will bring us through this space.
That's true.
Knocking on wood. Well, states, I think this stuff, the Republicans have botched/punted on national health care policy. They gave it 3 tries and they gagged on it. They couldn't figure out how to do it. I think what you're seeing now is going to play out on a very much state-by-state level, as we see in Idaho. Idaho is basically challenging the federal government, come and take it. Like, we're going to make this modification to Obamacare, and you come and stop us. And I think what you are seeing is that on a state-by-state basis, they're going to go through, and states are going to try different things, and we're going to see what works. I think that from a federal perspective, what we want to know is how is HHS going to respond to what these states do? How willing is HHS going to be to let people do what they want to do here and do what they want to do there? Association health plans could be a pretty significant thing, but I think that that is still a long way away from delivering the kind of insurance rates that Republicans are talking about.